Hi guys, welcome back to the channel. Hope you have enjoyed your weekend. Okay, there is one sort of information. After completing Impaction, I'll start next topic from next week. Which means कि to Wednesday तक I'll upload video. We'll complete Impaction there. And from next Monday, I'll start new topic. So please suggest me new topic for next class. Let's start. Canine Impaction. Field and Ackerman classification. Who has given canine impaction classification? Field and Ackerman classification. Okay, all canine impaction are based on the position of incisors, labial to that, lingual to that, or palatal to that. Now coming to classification, first is maxillary canine. They are divided: labial position, palatal position, intermediate position, and unusual position. Labial position: crown in intimate relationship with incisors. Okay, all canine classification are with respect to incisors. And second is crown is above the apices of incisor. This is for labial position. Now for palatal position: crown near the surface in close relationship with roots of incisors, and crown deeply embedded in close relationship to apices of incisor. This is in close relationship and this is deeply embedded. Now intermediate position: crown between lateral incisor and first premolar roots, and crown above these teeth with crown labially placed and root palatally placed, or vice versa. Crown above these teeth means incisors and premolar, with crown labially placed and root palatally placed, or it can be root labially placed and crown palatally placed. Unusual position: it can be in nasal or antral wall, or it can be in infraorbital region. Okay, now coming to mandibular canine impaction. These are of two types: labial position or unusual position. Labial position, it can be vertical, horizontal, or oblique. Okay, these position are with respect to the existing incisors. Now unusual position at inferior border of mandible, in mental protuberance, or migrated to opposite, left to right, okay, or right to left, whatever. Labially tilted lateral incisor emphasize that canine is hitting the root buccally. If incisor, lateral incisor, is labially tilted, okay, then it emphasizes that canine is hitting the root buccally. If incisors are labially tilted, canine is hitting the root buccally. Now what are the causes for canine impaction? Greater traveling distance, okay, as in tooth traveling distance. Hard palate resistance, thick palatal periosteum, changes in primary canine, last tooth to erupt, hence vulnerable for a long time to environmental influence. Okay, it is the last tooth to erupt in oral cavity. Erupt in between teeth, that is lateral and premolar, so there is a competence for space. Okay, mesiodistal diameter of primary canine less than the mesiodistal diameter of permanent canine, which means the space is there but the space for the permanent canine is less, because the mesiodistal diameter of primary canine is less than the mesiodistal diameter of permanent canine. Okay, these are the causes. So we have dealt with canine impaction classification, maxillary and mandibular canine both. In maxillary we have seen labial position, palatal position, intermediate position, and unusual position. And in mandibular we have seen only two, labial and unusual position. And we have known the causes for canine impaction. Now coming to clinical assessment: absence of tooth beyond the chronological age of eruption, displacement of adjacent tooth, presence of a labial or a palatal swelling, resorption of adjacent tooth roots leading to their mobility. All these, when we see clinically a patient, we can observe all these when there is canine impaction. Okay, I am giving a very short info about canine impaction or maxillary impaction. We have dealt a long discussion, or have a long classes on mandibular impaction. Okay, so I am just giving a brief about canine impaction if all it been asked. Okay, Now radiograph assessment, you can use IOPA, occlusal radiograph or shift cone technique, slop technique. Now pre-operative consideration, age देखना चाहिए क्योंकि we know the time of eruption is late. Then position according to the classification. This can be done with radiograph and adjacent to resorption. What are the treatment option? First is the leave the tooth in sinus. Second is surgical exposure of the crown. This is mainly done for orthodontic purposes. Okay. Surgical repositioning, surgical transplantation, this is very less followed, and surgical removal. We will be dealing this in detail in next class, or we will continuing with this only. Okay, till then, like, subscribe and comment. Bye.